Good morning. This is Angie Harris, the Regional Marketing Manager for Achieve TMS Central. Thank you for joining us for our virtual grand opening of our TMS Center in Mason City, Iowa. We are located in the Prairie Ridge Behavioral Health Center at 320 North Eisenhower Avenue in Mason City, and we are just waiting for the rest of our guests to arrive. So I guess I'll take a few minutes to kind of show you what our office looks like, and we'll just go from there.
Don't try and hide.
So this is Judy and Colleen from the Mason City Chamber, Becca, and we'll do all the formal introductions, thank you, as soon as everybody arrives. And then we've got Paige over here. So you can see that the office is nice. It's very inviting. It's a small, intimate setting so that you have a nice, intimate time with your technician during your treatment. Here's a quick little view of our machine, and we will be doing the live demonstration of how that works, what it looks like, and what it sounds like, so stay tuned for that. During our treatments, you do have the opportunity to watch Netflix and videos and things like that. If you bring headphones, you're able to listen to whatever shows that are of interest to you while you're getting the treatment. And a lot of times your technicians are watching them with you, so you get to kind of gab about your favorite shows together. I'm going to show you just a little bit of what our facility looks like when you're coming into the building. The Prairie Ridge Behavioral Health Center is a beautiful new building. They've been gracious enough to invite us into their space and let us work out of here. So straightforward is the reception desk, front desk when you enter in. Because of COVID, obviously, everybody is expected to be wearing a mask. They will provide them if you don't have a mask, and they are doing temperature checks at check-in as well. We are just straight down this hallway. You'll go past the pharmacy, which I'll show you here. This is the Genoa Pharmacy. They're right here. And we are just down here to the left. So when you arrive to your appointment, you can expect your technician to already be here waiting for you, and she will get you started. Sure. While we wait for the rest of our guests to arrive, I'll just show you a little bit of information about what TMS is. It stands for transcranial magnetic stimulation. It is FDA approved and cleared for major depressive disorder, which we are offering treatment for in Mason City. There are a lot of benefits to TMS. There's a long-term symptomatic relief. It is a safe and non-invasive treatment. Typically, it is very well-tolerated treatment. There are no medication side effects from it. There are no long-term side effects, and it is covered by most insurances. If you're unsure about whether or not your insurance covers it, please reach out to us, and we will help guide through that to see if it is something that is covered by your insurance. If at any time you want to talk to a person, you can reach me, and I will make my information available afterwards. But my cell phone number is 515-512-6366, and I can help you with any questions that you might have along the road. Some other things about how TMS works. It's a simple process, really. It is magnetic pulses that are sent across neural pathways to activate mood centers in the brain. And really what it does is it restores brain function for lasting change and complete remission in some cases. If you wanted to visit our website, you can learn more about us. We are at www.achievetmscentral.com. You can also find us on Facebook, Instagram, and Twitter.
Exactly. I went like that, and I'm like, no.
Hi there, I'm Judy Hager. This is Angie.
Hi there, how are you? Angie Harris. Sorry, oh, I forget. Oh, gosh. Corona rules. Sorry about that. So, yeah. Had you ever heard of TMS before this?
No, I haven't.
Yeah, it's pretty, it's not as new, it's just newer to the area. So, we'll do a little slideshow presentation kind of what it is and some of the benefits and the target population we're looking to help. So it's pretty short if you want to stick around for that afterwards and just learn a little bit more about it. I do believe we're the first TMS center in Mason City. It's closest that I know of is either Rochester or down in Des Moines. So, and we also have an office in our Ankeny area. So
I'm assuming this is nothing like electroshock.
it is nothing like ECT. Nope.
Good to know.
Yes. Yep.
Much less invasive and Curran, you don't have to be put under with anesthesia. It's completely outpatient. There's no memory loss. You can drive away from your appointment. So.
Now, does your doctor need to,
Make a referral?
Yeah.
Not necessarily. People can self-refer, but we do communicate with the providers. So once somebody gives us that release, then we communicate with people's psychiatric providers in case they would have any concerns.
I have a friend that lost a child, and she's going through, obviously, a rough time. And I know she's seeing a counselor, but she doesn't seem to be out of it very
Mhm.
well. So that's why I asked.
Sure.
Yeah, definitely. Give you one of Angie's cards and keep it for reference.
Yeah.
Oh wait, these ones don't have your.
They're on the lunch boxes. So when you grab a lunch box, it's got my card with my phone number on it.
All right.
Yep.
So that's got the old number. That's no good. Oh, that one.
Thank you, Paige.
Yeah, I really worry about her. So.
Sure.
Yes.
Yeah.
Yep. And that's just it, it's so common that when you go out and talk about it in the community, everybody's like, oh, I've got this friend or I've got this family member, but yeah, it's a lot more common than people think.
Yeah, I think you're right.
Especially people suffering from depression feel like they're so alone and there's nobody else, but it's really pretty prevalent.
Well,
Mhm.
and I just read somewhere that because of COVID and isolation,
Mhm.
that there's a lot more people suffering from depression right now.
You bet.
Absolutely.
Yeah.
Yeah.
Mhm.
And I can believe that.
Yeah. Mm.
I just gained weight.
Yeah. Hi there. Welcome.
I'm Abigail Lee.
Oh, yes. Hi, Abigail. How are you?
Hard to see like two people on.
Yeah, that's all right.
This is Angie.
Yep, and Paige, and yep. Cool. Yes.
No, she's the only one that responded. Very good.
All right, so we're going to go ahead and get started. I'm going to sneak into the doorway so I can get a full room. Okay. Yep.
Good afternoon, everybody. I'm Rebecca, the Regional Operations Manager for Achieve TMS Central. Thank you for being here with us today to celebrate the grand opening of Achieve TMS Central at Prairie Ridge in Mason City. We are so excited to offer this service in Mason City, and thank you to the Mason City Chamber for being so supportive and welcoming of Achieve coming into this community. It's really been great. And we're also really grateful to Prairie Ridge for establishing this relationship with us in order to create an avenue of accessibility for this valuable treatment resource. So, I would like to recognize Angie Harris, our Regional Marketing Manager, who is behind the camera today, for all the hard hard work she put into not just this event, but there's so much that goes into establishing yourself in a community, and we're just really grateful to her.
Thank you.
And of course, our leadership team for their ongoing guidance and support. So I would like to introduce our team here in Mason City. This is Paige Lacey, our TMS technician.
Hi, Paige.
Hello. Paige's desire to help people and her experience with hands-on patient care as well as attention to detail has made her natural at this. And of course, Judy Hager is our psychiatric mental health nurse practitioner, and Judy has extensive experience in TMS, and she's also continually broadening her knowledge pool, so she really approaches patients from a holistic-minded standpoint. And honestly, Judy has been a great patient advocate, so we're just really happy to have this wonderful team here, and I really feel like we're going to provide excellent quality care here in Mason City.
Yes, thank you. Yeah. All right, Judy, do you want to say a few words?
I'm Judy Hager. I'm a nurse practitioner and a psychiatric mental health nurse practitioner. I've been working with TMS for the last 3 years. I've seen it used in many different facets, and I've seen remarkable results. I'm very holistic, so I'm all about doing an alternative approach that's less invasive with no side effects like we're seeing with medications. Currently, we're, as Rebecca was saying, that we are FDA approved for depression and OCD, but there's so many other ways that we can use TMS to treat disorders. And we're working on the opioid addiction and pain and anxiety and the other facets that people fight with diseases and disorders in their lives. So it's been a very welcoming opportunity to be involved with TMS and here at Prairie Ridge. And so it's been very exciting that we're finally getting our ribbon cutting day. So we're looking very forward to that. And we also appreciate, as Rebecca was saying, the involvement and support that we've had through the chamber. And with that, I'd like to introduce you to one of the Mason City Chamber ambassadors, Abigail Lee.
Oh,
On behalf of Mason City Chamber of Commerce, we really are excited that you're part of the Mason City Chamber and your members, and we really want to welcome you to our community. And we acknowledge that business is vital for our community to succeed, and we're really excited that you're part of the chamber. So welcome.
Thank you. Thank you.
Cut a ribbon?
Yes.
Okay. What we'll do is we'll have our ambassadors line up on either side. If you guys want to come in the middle.
sure. Judy gets to do the honors.
Thank you, ladies. Let's get behind me, though.
All right, you sit there back to the front.
Yay.
We'll get a count of 3. I'm going to take a few pictures first. So just kind of look this way and smile.
Yeah, right?
Really angry.
All right, smile with your eyes. And on the count of 3, we can cut. 1, 2, 3.
Yay! Woo. Yes. Yes, thank you.
So, like when I opened my business, we did this as well, and I actually have these still, and I'm going to frame them. I haven't done yet. But so you can have the ribbons, and then we also
Thank you.
Give you a Mr. Toots ornament, and a thank you gift for being part of the chamber. Yeah.
Oh, wonderful. Thank you.
Yeah, there you go.
Thank you.
So I didn't know if you wanted to put this part of the video or not, but I don't even know exactly what. Every time you said
TMS,
I
yes.
TMI. So what exactly does TMS stand for, and how does it work?
It stands for transcranial magnetic stimulation. Do you just want me to do this part?
Yeah, you might as well.
Let's do that. Then it kind
I'm
of
going
answers
to
your
jump
question.
behind you
So-
here so I can grab her.
And
Thank you.
this will explain a little bit about us as a company too. So we are Achieve TMS Central, and we are a mission-driven organization dedicated to helping people suffering from major depression and OCD with deep transcranial magnetic stimulation. So that's TMS is transcranial magnetic stimulation. So what we do is we collaborate closely with community providers, and our clinical team really strives to provide outstanding, high-quality care and give hope to our patients in a supportive and positive environment. So, like we were talking earlier, the prevalence of major depression is actually really common, much more common than people think. 1 out of 6 Americans will suffer a major depressive episode, which is roughly 15 million a year. So that's 6.7% of U.S. adults in any given year have major depressive disorder. Of those 6.7% of U.S. adults, 32% of them are resistant to any drug therapy. So it's that 2% of adults in the U.S. that suffer from treatment-resistant depression that we really target and give hope to. And what studies have found is that with treatment-resistant depression, the likelihood of achieving remission with each successive medication trial decreases. We know that the brain functions differently when it's depressed. There's changes in brain metabolism and blood flow. So you can see the less activity here in the prefrontal cortex. So in major depressive disorder, there are certain structures of the brain that have been identified as key players. And this is kind of the depression circuit, okay? So of these structures, some of them are underactive while others are overactive, specifically the anterior cingulate cortex. And what TMS does is promotes the release of neurotransmitters. So the magnetic stimulation is applied to the prefrontal cortex, which then stimulates down the line to the deeper structures in the brain, and of course all the way back up. So you've got the whole circuit is increasing in activity. And TMS is not really new, but I mean it's pretty new around here in the Midwest, but it's been around for a long time. And they have been using surface TMS has been FDA approved to treat depression since 2008, and then in 2013, Deep Tms was FDA approved to treat depression as well. So the two types of TMS are the surface TMS and the Deep TMS, and I'll just let you know they are making wonderful advances in technology. So this is kind of how it is right now, but I'm seeing us moving into a wider variety of TMS that's available. But the surface TMS penetrates about 2 to 3 centimeters, whereas the Deep TMS penetrates 4 to 6 centimeters. And they found that deeper penetration stimulates the deeper structures of the brain that have significantly more connections to the mood centers in the brain. So it's giving better treatment results in major depression. So this is just a comparison of, in major depression, this is, Deep TMS, and the blue is a response rate, and the red is a remission rate, and then this is surface TMS for the response and remission rate. This is just a study done in 2018 in Croatia that gives you a little bit of a comparison here. So this is with 4 weeks of treatment. So we got the H1 coil is giving a 72% response rate, whereas the surface one is giving a 44% response rate, and medication alone is about 26.4% response. And then of course this is remission. So with the Deep TMS we've got a 64.6% remission rate and a 43% with the surface TMS and only 12.5% with medication or achieving remission. The other thing that the studies have shown is that repetition is key to getting results. So just the comparison from having 20 sessions to 30 sessions with your remission rates in green and your response rates in blue, it is important to do the whole program as far as getting the better results. It kind of retrains your brain to be more active, kind of like how exercise works better on long term and you get that increased resting metabolism, training your brain to be more active. The referral process is actually pretty simple. People can self-refer, providers can refer, therapists can refer, it's really anybody can refer. And then of course we do our own screening process to make sure that it's a safe and healthy treatment option for the person, and we follow up with their providers too to make sure that there's no concerns. But the referral process is actually very easy. Maybe I skipped some of that. The treatment regimen, like I said, it's important to stick with it and kind of do the whole thing because the results are so much better. So it's 30 treatments, 5 days a week, so that's 6 weeks, 5 days a week. And then it tapers down to 6 treatments, which is 2 days a week over the course of 3 weeks. And the treatment itself only lasts about 20 minutes, so your appointments last roughly a half an hour. And the really, really great thing about TMS is there's no systemic side effects like there are with medication. The main complaints are short-term side effects following treatment, general fatigue, headaches, neck pain. And typically that starts to diminish as people get used to the treatment. And of course we have to address the risk of seizures. There was no seizures during the clinical studies. There's been 6 seizures reported in the post-marketing period, so it's a 0.1% rate, which is less than some antidepressants have as far as the seizure risk. So it's a pretty safe treatment. This is just a comparison chart that shows the side effects. Like I said, with TMS, your side effects are mostly, fatigue and headaches, whereas with antidepressants, it can be memory loss, nausea, weight gain, anxiety, dizziness, different mood things. There's a myriad of side effects that go along with medications. While they do have an important role to play, some people can't tolerate the medications. And of course, with ECTs, there's the memory loss and the dizziness and the nausea and dry mouth and anxiety, as well as insomnia and drowsiness. Contraindications to TMS would be if you had any metal implants in your head or your neck, other than dental implants. Dental implants are not magnetic. So, pacemakers and implantable medical devices. Depends, like say if you had an implanted insulin pump down here, it's too far away, it's not going to bother that. A history of seizures or epilepsy is reviewed case by case just because of the low risk of seizures. Obviously, we want our patients to be safe. Substance abuse, certain substances do lower your seizure threshold, as well as neurological conditions that can increase your seizure risk. So we do like to be aware of that. Severe dementia, TMS doesn't necessarily affect dementia, but it's not something that someone with severe dementia would understand and probably be a stressful situation for them. And as far as pregnancy goes, really, there haven't been very many studies involving pregnant women, so there's nothing to say that it is safe for the unborn child. So we just err on the side of caution. And of course, Achieve TMS Central participates with our major insurance carriers here, as well as some smaller insurances. And we are definitely working on getting on board with more insurance carriers. It's a process, so if somebody doesn't see their insurance carrier there, it's definitely worth asking, because reaching out to insurance companies to get in network with them has been pretty easy. They're very accepting of this now. And like Judy mentioned, there are ongoing studies about other potential indications for TMS. It is FDA approved to treat OCD, but they are doing studies on bipolar and smoking cessation and opioid addiction too. So pretty exciting future. We pride ourselves as, using groundbreaking technology, excellent patient care. We communicate with existing providers. I mean, patient care is really our top priority, and that is definitely how we approach this. So, we don't like to make people wait for their first appointment. As soon as we get through with insurance stuff, we're in and we're going. And of course, we handle all of that. We don't put the burden on the patients or the referring doctors. And our staff, of course, is specifically trained in TMS. And we have accommodating hours, so people can come over their lunch hour, before work, after work, since it doesn't impact your cognition or ability to carry on with your day. It's just an outpatient procedure, and you can come in and go back to your normal life. And of course, like Angie mentioned, we can watch Netflix, appointments, and just be distracted and have relaxing time, quiet me time, right? And accessible to public transportation as well. We are observing increased safety guidelines for COVID-19. The nice thing about the way that we are structured is it's always one-on-one with the technician and the patient. So really all we had to do is build extra time into the schedule for them to do a more thorough cleaning between each patient. So absolutely, and of course masks are provided, and anything that's needed, we're ready to offer. And we offer telehealth options for pre-treatment and post-treatment appointments.
Oh, that's cool.
Yeah.
Yeah. So, did I answer your question about what TMS?
That was the short version. Can you imagine the long one?
Short and skinny of it.
Yeah.
How did you not know that?
Yeah.
And we're really having some great results in people suffering from treatment-resistant depression. It's been
Awesome.
Yep, really good.
Well, thank you.
Yeah.
Absolutely. Of course, Paige is ready to do a demonstration.
Oh, I'm
Yeah.
ready.
We've got a quick little demonstration so you can see it and hear it live in action.
Well, okay, and I'm gonna put my hair back because this just always messes with your hair. We just mapped me the other day, so we don't have to go through the entire mapping process. Judy and I did this on Monday, so we already know my coordinates. But I'll just kind of explain to you how we do it, how we find the treatment area on each person. Sorry if I'm not.
It's all right.
So we map each person. I'll sit over here so people can get me ready. Looking for motor responses. So we're looking for the area of the brain where we get the most isolated movement in the right thumb. Okay? And then from there, well, there's a series of steps that they take them after that, you know, to check different locations and different various tilts and things like that. And then we go from there, and there's kind of a formula they use that takes into consideration various head shapes and sizes, because obviously everybody's head is very different, to find the best treatment location. So when they mapped me on Monday, my mapped location, I believe, was 6 and 7, and my motor threshold was 44. So we also test for the motor threshold, which is the lowest amount of power that gives you a response. Okay? So we'll do the map location first to show the thumb, and then we'll just put it in the treatment location, which was 2, 3, I believe.
Yes.
Yep, 2, 3.
All
And
right.
just
So we did an angle.
run some pulses so they can hear what it sounds like.
Absolutely. Okay, so first let's get your cap on here. It's got your grid. That's going to show me where I place the helmet.
You're so sweet to volunteer.
Oh my gosh, this poor girl.
I get practiced on all the time, so hands-on practice is key to it. And I can definitely say that I am, I got earrings on. I'm less sensitive to it now than I was like at first, so I can see how it's, you know, you kind of get used to it. This one's kind of up in my mouth.
Good.
Mhm.
And then we said your map location was here.
6, 7?
Yes.
6, 7.
And this is the
Sure, yeah.
Oh, I was like, what? Okay, pretty cool. So,
Thank you.
Anytime I hear marketing, I'm like,
Thank you so much. Yeah.
it's okay.
So it'll take a few minutes.
Do you want me to strap it in or just leave it?
I was using this, yeah. Because you're gonna move it in a minute. Nope, I don't need it. I'll just hold it myself so you can see.
And then what was your
44.
44 was my motor threshold, yep.
Okay. Ready?
Okay, so what Paige is gonna do is just administer a single pulse to get a reaction in that time.
Alrighty. 3, 2. I gotta charge this. It's definitely not gonna work if I don't charge it up, huh? Okay, let's try again. Here we go. 3, 2, 3, 2.
Mm-hmm.
There it is.
Mm-hmm.
3, 2. So we keep going.
You don't have to go.
Okay.
I can't see it because it makes my eye close, so I can't tell if I can't see it now.
So you notice a little twitch, and that's where you're hitting the motor
And then your
threshold.
treatment site was where?
What we like to do is isolate mostly in the thumb, not the whole hand. So
That's changed a lot since the last time.
arrive at the motor threshold, right? Then we adjust the intensity to go to the lowest
But yeah, for this one,
intensity.
go ahead and
So
strap it
say
and we just
45.
need to run
Let's try it at
2
40.
cycles
Let's try it at
so we can
43
see it.
and see when we get, when it goes away and when it comes back, and that's the lowest threshold. And that's how we determine what level we start at treatment.
Thank you.
Thank you very much.
So now she's at my treatment location, and she just strapped it in so it's nice and secure, you can talk to her and look at her and stuff, so. And she's just gonna run a couple cycles so you can hear what it sounds like.
I'm like nervous for you. I don't know why.
It's not to be nervous, I've done it a bunch.
I'm sure.
It does, it'll make my face muscles twitch, but, it really doesn't hurt.
Yeah.
It just kinda feels like a little
Interesting.
Mm-hmm.
grass.
I'm definitely like Becca. At first, I was not a huge fan. I didn't like the helmet, and I didn't like just the feeling of it. But after a couple of times, I'm like, I'll volunteer. I don't mind. Yeah.
It's really, the results are not having depression.
Yes, right. I would rather go through a little uncomfortable moment.
Yes.
Alrighty. So, when a patient gets in or gets strapped in the helmet, they're obviously going to have earplugs. We're going to turn this fan on, which keeps the helmet here from overheating. So I've done all that. The system gives me some prompts saying, okay, does your patient have all of this? Once that's done, I just hit charge. That's telling the helmet to get ready. We're going to get ready for treatment. And then I say, okay, Rebecca, are you ready?
Yep, I'm ready.
All right, here we go. And at this point, I would inquire if, if the pressure was too heavy, if they were uncomfortable, how the tapping feels, because especially some of this just starting treatment, when we go up in those percentages, it does change the power of that pulse.
Mm-hmm.
Then you let me know when you're ready to be done.
Oh, I'm good.
You're good?
Yeah. Is that what you expected it to sound like? Right. Yeah. Yeah.
It goes through that cycle, so you'll have the series of taps, and then it'll give a break, and then it'll give a little warning when it's gonna go again, and then you can series number 1 for about 20 minutes.
Mm-hmm.
That's the treatment.
Mm-hmm.
We also do some questionnaires to assess how they're doing in between. That's kind of how we judge if they're doing better as well as how we are seeing them. Because sometimes visuals is everything. But we do questionnaires for depression and anxiety and just see how they're doing and checking in for week to week, that type of thing. So,
Great.
internationally used depression and anxiety screenings.
Awesome. Very good. Thank you. All right. Well, if you, yeah, thanks, Paige. Thanks, Becca, for being our guinea pig. I appreciate it.
Happy to be a guinea pig.
Yeah, yeah.
You never know, maybe it'll make me smarter.
Hope you're hearing.
You're up. Your earrings fell down.
Yep, thank you.
All right, well, that is the conclusion of our live demonstration. I want to thank everybody for their participation and coming out and doing our first virtual grand opening. So we're trailblazers, really.
Yeah, absolutely.
So we look forward to hearing from folks. And again, if you have any questions, please feel free to call. Reach out to us online, www.achievetmscentral.com, or find us on Facebook. So thanks, everybody.